Evening friends, greetings from Nikhil Kidney and Maternity Hospital. Today I am showing a very interesting case where a female presented to us with a right mid-uretary calculus. She has undergone 8 times URS on the same side. She is a recurrent stone former. Initially, when I have done URS with a semi-rigid scope, I was able to see the stone but not able to reach it because of acute angle. So stented the patient, and this is post-stented taken up for flexible. On doing flexible scopy, you can see how tight the ureter is. There is no chance that access sheath was going into this. So directly without an access sheath with the scope, negotiated this very tight and narrow ureter, and somehow with lot of difficulty I was able to go beyond this narrow ureter in the mid-ureter region and was able to see the stone. After seeing the stone, this is how the narrow ureter part was negotiated and stone was seen. Stone was very hard. With the help of thulium fiber laser, the stone was completely fragmented. Till here everything was clean and clear. Now the problem starts. The problem is, can you see the flickering movement? That is because my scope got stuck at the level of the narrow ureter. Now I am not able to advance forward nor able to come back. I am not able to move any bit. It is only the scope moving here and there, but it is not going forward or backward. So at this point, I removed my laser and I started flushing in the hope that some water might come between the ureter and the scope may get dislodged. But it was not happening. So with some amount of flush and how in a semi-rigid scope in a tight ureter we negotiate when we come out, we turn left and right the same way. Now you can appreciate the left and right movements. This is how I am rotating my flexible scope left and right. So with this maneuver, somehow I was able to dislodge from the ureter and come out. This is again, I am entering to see if everything was normal or not. At this point, I completely came out of the ureter. And applied some amount of jelly on the flexible scope and re-entered into the ureter. Everything looks normal here. Now I am able to reach the calyces. These are the calyces that I reached, and after this the stone was cleared, and then I could stent and the patient got discharged